Hello, hello, and welcome back to the Resting Stitch Face podcast. I'm your host, Dr. Sarah Harding, along with
Dr. Erin Sheffield. It's so good to be back. We are so excited. We are just coming off the doctor is all in retreat. I've been home for about a week and it was so amazing. We are so excited to have our friend, Dr. Sumi Yalamanchilli, join us. Thank you so much for being here. We are so
Thank you
glad
so
to have
much
you
for
to chat with
having
us
me.
today.
yes.
Can you introduce yourself to our listeners?
Yes. Hi, my name is Sumi Yalamanchilli, and I am an oral surgeon in Maryland. I was born and bred in Maryland and have lived in the Mid-Atlantic area pretty much my whole life. And then I'm in private practice for the past 15 plus years. I'm a
Very cool.
mom. I have 3 kids.
How old are they?
So they are 16, 14, and 11.
Wow.
Yeah. Yeah.
Nice. And then where did you train?
I went to University of Maryland Dental School, and then I did a 1-year GPR at the Philly VA because I didn't know I wanted to do oral surgery until we already had to apply. And I trained at St. Joseph's Hospital, which is a regional trauma center in North New Jersey.
Okay, cool. And is that a 4-year or a 6-year program?
It's a 4-year with a 2-year option, so I did the
Okay.
4.
Okay,
Yeah.
perfect. Yeah,
Yeah.
awesome. And then you're in kind of the Baltimore area, is that right?
Yeah, I'm
Okay.
around the Baltimore area.
Okay. And then your main scope of practice?
So it has varied over the years, but I am
Mm-hmm.
currently a oral surgeon in a general dental practice, a private general dental
Mm.
practice. So I have a location and the other offices kind of refer to us in this one location. There is another oral surgeon that just joined us in August. So I've kind of been able to take a little bit of a step back and hang out with my
Cool.
family more. So
Yeah, I want to talk
yeah,
more about that model because I think that
yeah,
that's really cool, and I think it's becoming
yeah.
more common.
Mm-hmm.
Yeah.
Yeah.
And so before that, so when you got out of residency,
Mm-hmm.
were you like, "Okay, full scope oral surgery, here we go."
I really wanted to. Yes, I was taking trauma call at a community hospital. I was on staff at another hospital. I was working out of a surgery center. I was in like 2 different office locations. It was a little bit hectic. And then
Mm.
2020 happened and I stopped taking call and I was working 2 days a week throughout the shutdown because my husband and I were like alternating days we were working to be home with the
Okay.
kids. And then, yeah, I decided I need to take a little bit of a step back. So I did. And then it got busy again. So I took another little step back recently. So yeah, it's been an interesting journey. Not
Right,
traditional at all.
So how
right.
many days a week are you working right now?
So I'm this week 4, last week 2. So it just varies. Yeah.
Okay. And then you mentioned that your husband's an orthopedic surgeon, right?
Yeah. Yeah.
Okay,
He's an orthopedic joint surgeon. We met
okay.
in residency.
Oh, cool. All right. And so then he's full-time in practice or is he
Yeah. He's full time. Yes, at a local
okay,
hospital. Yeah.
okay. It is
So
funny.
how do
I do
you manage a two-surgeon family? What are your tips and
Yeah.
tricks?
So when we moved to Maryland, I'm from Maryland and my husband's family lives in New Jersey. So he's like, we got to move to New Jersey or Maryland near your family or mine, which was actually, in retrospect, a very good move. We ended up moving to Maryland because he got a fellowship here. And we lived with my parents for a couple years until we figured out if we were staying or not. And then we moved down the street from them.
Oh,
So
cool.
it's super helpful when we both have call and have to go in that my parents were like, okay, we'll come over and watch the kids.
Wow,
We had
that's
a
amazing.
nanny. Yeah. Yeah. We've had a couple babysitters at one point. It's been a lot to juggle, but it's worked out and it's been fun. And the kids are a little older now. So I wanted to spend more time with them. So I stopped taking call in 2020 and
Yeah.
kind of just focused on office-based practice.
Mhm.
Okay. And so did you have I'm doing math in my head and it's a little
hmm
slow, but did you have a baby in your chief year?
I was pregnant my chief year.
Okay.
So
Okay.
I was pregnant the December of my chief year, and then
Wow.
I finished residency, and I was on modified bed rest for a couple months until I had him.
Oh,
Yeah,
wow.
Wow.
and then he ended up going to the ICU, but he's healthy and happy now. So yeah, yeah,
Wow.
and then boards in the middle of that. So I
Is
had
that We've talked
yes,
about this before. Is it
Yeah.
a requirement to either be pregnant, recently postpartum, or like nursing to take your boards as a
I
woman oral
know.
surgeon? Because I think it's every single woman's story that we've talked to.
Yeah, because we're trying to plan life around boards, right? So at least I was. Yeah, yeah, exactly. When I took my oral boards, I was pregnant with my second, and I was exhausted. And I was only 12 weeks pregnant, so I finally was
Oh,
able to
that's
tell
Oh, you were
people,
sometimes
so
the
yeah,
exhausted.
worst time. Yeah.
yeah, yeah. So
And
luckily it all
no
worked
one
out.
really knows you're pregnant a lot of
Yeah,
times, so you don't get to
No.
like milk it for at least
no,
like, oh, that poor thing,
yeah,
taking
nope,
boards while pregnant. They're just like, why is she falling asleep?
Because, like, I'm getting
yes,
kicked currently. They're like, "You're getting kicked?" And I was like, "Yes." I mean, don't they're like, "Oh gosh, didn't even notice."
That's nice that you maybe could hide that under a desk or something. That was
yeah,
not me
yeah,
with
that's not,
twins.
Yeah. Yeah.
yeah,
Cannot.
yeah, it must have been rough with twins.
Uh,
Yeah,
yeah, my boards
yeah.
were a few months after having twins, and no one in our
Oh.
house was sleeping, and yeah, that was a whole other thing. So
You know
yeah,
what, though? We all got through it, right?
we
We did.
did.
Yeah,
Yeah,
we did
we
what we
did.
had to do and we got through it.
For
Right.
sure.
Yeah,
And you look back
yeah.
on those times and you're like, "How did I do that?" And then
Yeah,
you're like, "Would I do that
yeah,
again?" And you're like, "I don't know if I could," but you
I
did
was
it then.
yeah.
complaining the other day because I like chose to work a couple extra days. I usually only work 3 days a week, but if I'm like going on a trip or something, I'll choose to work extra sometimes, or I'll pick up a day in
Mhm.
the OR. And I was complaining like, man, I worked 5 days this week. I am exhausted. And then I'm
Yeah,
like, my residency self would be like horrified that you're complaining
yeah,
about
yeah,
that.
yeah,
I know. So I'd like to talk a little bit about the retreat because it was
yeah,
fantastic. And
yes.
Sumi, I went last year as a
Mhm.
participant, and so I'd
Uh-huh.
love to hear like all that you think about like how it went this year. But when we were
Yeah.
leaving, I was talking to Laura Parker, and she, same thing. She was pregnant, I think at like a little bit not quite as far along, took boards, flew back, and then had a emergency uterine eruption, like, on the
Oh,
Monday that she
Oh
no.
got
my
back from
gosh. I
boards.
didn't know that.
Oh my
Yeah, and so
gosh.
she had planned to, like, take boards and then have nesting time and time
Yeah,
to,
yeah.
do all the things, and
That's
she's like,
horrible.
"We didn't have anything. I hadn't even had a baby shower yet, and, like, didn't even get a nesting time," and then it was yeah.
No.
Yeah,
Yeah,
so
that's
Sad.
heartbreaking.
and you just
The
think,
stress
like, the
of boards, I'm
stress.
sure,
Yeah.
Yes.
Yes, I'm sure.
inciting
I'm sure.
events.
Mhm.
Yeah, yeah.
So, Sumi, what'd you think about the
Yes.
retreat?
I really enjoyed it. I graduated residency in 2009. So
Okay.
there were female oral surgery residents, and we had one female attending. But I didn't ever feel surrounded by female oral surgeons in this uplifting yet down to earth way. And usually when I go to meetings, it's formal meetings
Yeah,
and
it's not
or
like
we'll go
that.
to like happy hour. But this was a very different vibe. And it's really nice to see so many of us coming together and just trying to like uplift one another. And I think that as generations have changed, it's good to see women helping women in this way. Yeah.
Yeah. Do you have very many females around you in Baltimore?
Now we do. Now
Okay.
there is a group, especially towards the DC area. But
Mhm.
when I first, so I was in private practice in New Jersey for about 18 months after I had finished residency and had my son. And then we moved to Maryland. And when I was here, there was really no oral surgeons that I'm aware of, like north of the DC
Oh,
Beltway
wow.
area for a while. It was male dominated. And as the years have gone by, there are definitely more females. And, in dental school, I was a second year, and one of the fourth year female students got into oral surgery. And I never thought of oral surgery on my radar. And I was like, if Lisa Cohen can do it, I can do it. And I recently told her
I
this
love
story.
that.
She's like, "Thank you so much for saying that to me." And, she was like my mentor. Like, I looked up to her and she didn't even know who I was.
That
So,
is so cool.
but yeah, you see someone else doing it and you're like, wait, I can do this too. So,
Yeah.
I
yeah.
think the visibility is so important. I think
Hmm.
for me, I had similar experience. I didn't think about dentistry. My dad and my sister suggested it to me, and I was like,
Hmm.
what? To
Yeah.
me, it was like I never thought to be a welder or a truck driver either, just because I'd never seen women in those
Hmm.
roles. And when
Hmm.
you can visualize yourself in that role, it's so much easier to choose it and to
Mhm.
to realize that it is an acceptable path. So that's a really
Yeah.
cool story.
And one that you actually enjoy, right? Like, we worked hard to get here and we actually hopefully enjoy the path we've chosen.
Yeah.
So,
Yeah. It
yeah.
is funny though, right? And how it can shift and change because what was
Yeah.
portrayed to us in residency is
Mhm.
very, like, centric point of view from the men that taught us,
Yeah.
and it's not just us, but I feel like our male counterparts too. The
Yeah.
path that we have taken since residency is very different than what was set in
Yeah.
front of us,
Correct.
which is
Correct.
great.
Yeah. I mean, I went into dental school thinking I wanted to work just like 9 to 5 or 8 to 4 or whatever, general dental office hours, or even my oral surgery office hours now,
Mhm.
because I wanted to be home. Then I got to dental school in clinical years and I was like, oh, I really like oral surgery. So,
Mhm.
yeah.
How did you
Oh,
hear about the retreat?
I met Erin at Amos in DC, and she said,
Ah!
"You should come." And some of my friends and colleagues were there, and Fizza Jaffrey was like, "I'm gonna go. You should come." It's like, "Okay, let's go."
That's awesome. I love that. What was your
Yeah.
favorite part about the retreat?
I like the Texas twist on things too. Like, I
Mhm.
liked how we had clinical CE. I liked how we had female empowerment, but not like overwhelming female empowerment CE or talks, and how it's a small group. So everybody was approachable, right?
Mm.
Everybody was friendly and approachable. And there was the Texas twist with the hats and the line dancing. So, yeah, we got a little culture. So,
Yeah.
yeah, yeah,
Yeah. I love that. Those hats are
yeah.
cool, man.
I know. Aaron, I worked hard to bring that hat back in that hat box. I had stuffed my luggage. I put so much stuff in there and I came back with it and I put it on and my kids are looking at it. Yeah.
I'm so
Love
glad.
it.
I was like, "Okay, swag bags, what should we do?" And we're like, "Getting hats back is tricky, so a hat box would be really helpful." But
Yep.
also, I tried to make a social media post. My whole thought was like, "Bring more luggage." So I made a whole post. That was the first part, and then I had tips for a retreat. But that was the main point. It was like,
Mhm.
bring your bigger bag because everyone's always like, "Oh no, I can't fit everything in."
Yeah.
No,
Yeah.
so you gotta bring a big bag if you're going to an event like this because we're
Yeah. I had
gonna
to
have
check
the
the bag
stuff.
back.
We're gonna
Yeah.
have the stuff for you. I'm so glad
What
that you
did you
liked
guys
it.
enjoy about the retreat from your standpoint? Like, Sarah's a prior participant and now speaker, and Erin, the woman in charge.
I'll tell you something that was funny that happened to me. So I'm reading this book called Signs, and so it just opens your eyes. And I'm always kind of like this, a little bit ever since I
Mm,
moved to California, a little more woo woo than I used to be. And have really started paying attention to things. So my favorite
mhm,
number is number 29. It was my first soccer number. And I
mhm,
was walking up from where I was staying to where we were having our meetings.
mhm.
And there was a golf cart on the side, and it was the only one that was there, and it was number 29. And I was like, thank you. I needed that. I needed that little
Mhm,
vote of confidence, And so then I
mhm.
continued on my way, and I was so nervous the whole time. I could hardly even pay attention to Cassie's lecture because I was like, oh God. Oh, I'm next. Oh God. I hope that everybody leaves and needs to go get lunch or a snack. I'm like, oh God. And so I finally do it. I give the lecture and it was interactive. It was just what I was
Mhm,
hoping for it to be
mhm.
because I typically do the old school thing where I black out when I talk in front of people and then I'm like, "How did it go, everyone?"
'Cause you have
It
no
went
memory, you
great.
just
It
wanna
went
get through
so
it.
Good. Sorry,
well.
there's a
It
fly.
did.
Yeah, but I was like so just like, "Ah." And so then
Mhm,
we were going to do the ropes course right after. And so I
mhm,
like so bustled out of there because I had to go change out of my the hell I won't t-shirt, which was wonderful, and
mhm,
my Texas belt buckle. And There, I've got a thing with wind chimes, like, I hung one
mhm,
up when my puppy dog passed away, and so, like, now that's, like, their little communication with me, and
mhm,
so but, they had all those wind chimes in the trees,
mhm,
and so then I was walking back, and as I was walking past, each of the wind chimes started chiming, and it felt like applause to me, and I just, like,
mhm.
It
started
it was
crying.
Oh,
applause.
And I was like,
Oh.
"Oh my gosh, this is just so cool." I just get, like, tearful thinking about it because I was so worried and, like, you never know how it's gonna be taken, and especially
it
I'm
was
good I
great.
can tell you things about dentistry and
Mhm,
science and all this stuff all day
mhm,
long, but
mhm.
when you're talking about authenticity, I mean, oh, for God's sakes, right?
Yes.
And so I was,
Yeah,
like, just terrified because the whole time I'm like, well, Sarah, you just need to be authentic in your authenticity lecture.
exactly. Yeah,
So it was that I think that feeling of walking back was just exceptional because I think so often we put ourselves into a box and we are afraid to step outside of the box. And like
exactly.
the fact that Aaron gave me the opportunity to do it
Yeah.
and that I did it, and that it was so well received, and that everybody was so gracious and joined in. I just thought it was just such a incredible stretch moment, and I just thought that
Mhm,
was awesome.
mhm. So you had to do something a little uncomfortable, but at the end, you're
A
proud of
lot of bit
yourself, and
uncomfortable, yes.
yeah, you did great.
But it was
I
Thank
thought
you.
so
it was great.
powerful, and I think the fact you were nervous and you were open about that made it more powerful
Mhm,
in a way because I think we can all see ourselves up there doing something that we're not sure about and not sure if we're gonna do okay or not. Like that resonates with everybody. And the power of doing that in a group of women who are there like cheering you on, you know? That's what this is, like the continuing education part is just the excuse. It's the reason to like decide it's okay to take the time off and to come and to spend the money and to tell your spouse, your partner, and your clinic and all of that. But it's really about being in the room with these
mhm,
women who like, get you and see you for like, who you are. I loved how at the end, Amber Johnson talked about the arrival fallacy, this idea that we've been sold this life. Like, now you're an
Mhm.
oral
mhm,
surgeon, now you're a dentist, now you're a doctor, now you're a lawyer, whatever it is. And your life is supposed to be so amazing. Like, once you're done with residency, or once you're done with dental school, or once you're done with undergrad, or once you're done with high school. And then you get there, and then it's like, this maybe isn't what I expected. Maybe things aren't going how I wanted. Maybe I'm kind of pigeonholed into this place. And I loved how she talked about this armor. I'm feeling emotional after I
Yes.
say I was crying. But this armor that we put on that was so protective, it kept us safe. And
mhm,
Mhm.
we put it on in residency or school or in our new clinic, wherever we put it on, or maybe we put on, a helmet here and a shoe cover here, and we've got our sword. And now the imagery is so powerful. Like we've been carrying that armor with us, but it's really heavy. So
mhm.
maybe it makes us feel safe and maybe we're used to wearing that, but we're dragging it along and we can't move very well. And maybe we can't quite breathe and people can't see us for who we are. So we got this helmet covering us and this sword that we're willing to wield at anything that looks like a threat. And
Yeah.
I just thought that's such a powerful image, and I think that resonated with me so much that
Mhm.
we are all in some way carrying this armor that it's not really serving us anymore, and if we could shed the armor and find who we really are and show ourselves to the world and to be vulnerable, how much more free and powerful in a way we could be.
Mhm.
So I just love that so much, and I love what you're saying too, Sumi, about being willing to kind of reassess your plan. You were working a lot
Yeah.
more and then you backed
Mhm.
off and you kind of do a couple days a
Yeah.
week here, maybe a little bit more. And I wish that's one of the things I really want our community or the people coming to this retreat to be willing to do is to
Mhm.
live the life that's authentic to you, to
Correct.
be willing to make the changes, to leave the armor, the expectation behind, and to live the life that's authentic to you. And that might mean I feel a little uncomfortable backing off, but I really only want to work 4 days or 2 days or
Right.
three, but I'm going to make it work. I want to be there for my kids. Or I'm loving this time and grinding out and I'm going to work
Mhm.
5. I just want people to
Right.
live the life that they love, to make a life that they love, and to just own it. And so
Right.
I think that was just really powerful moment for me is just seeing people kind of get that message and hopefully start to assess
And it's
where they're
hard.
going.
It's hard, right? Because you were in high school working towards college, college towards dental school, and you just keep going and going, and then you get there, you've arrived, and then you think you have to stay on this path and work 5 days, 6 days a week, take call, do everything, but you really don't. I mean, no one is saying you have to do these things, and you really can switch it up if you need to, and it's okay to do that. And it
Yeah.
took me a very long time to understand that. And I felt guilty because I wasn't doing everything I was capable of as a surgeon, and I
Mhm.
wasn't doing everything I thought I was capable of as a mom. And I, like most of us, are type A, and you want to do the best you can at everything. So once you come to terms with there's some things that you're going to have to like, maybe not do the best at, or some things you're going to have to outsource, or you can't be in two places at once, then I
Mhm.
think you are able to figure out what is meaningful to you.
Yeah.
And then you're able to live your authentic life. And that's okay if you're going to have haters along the way,
Of
because you
course.
are, right? Even if you're
Well, and
doing
it's
everything
funny.
right, people are gonna
Right.
criticize. So
And
really,
Of
does it
course.
matter?
I
Yeah.
remember when I was in the military and, it's sort of like corporate, right? Where there's these metrics and there's these goals and they always
Yeah.
ask you like, what's your goal? Like, what's your professional goal? What's this? And I'm like, I've made it. This was it. This was
Mhm.
what I wanted to accomplish professionally. Like
Mhm.
you're asking me the same question that you're asking the general dentist that has been thinking about doing residency if they're the whole time in the Navy. But like,
Mhm.
I did it. Yay.
Mhm.
And so, but then
Yay!
and then I was like, okay, well, then I'll take my boards. Okay, there's something for
Yeah.
you. And then, and then you take your boards, you pass your boards. And you're like, okay, so what's next? And you're like, I just am going to enjoy this time.
Mhm.
I don't need to have something that's on the horizon. But it's like, you what? What do you mean? What do you mean you don't have something? I'm like, I'm off the escalator, that success escalator that Amber was talking about. I'm off the
Yeah.
escalator. I'm on the fifth floor already. And you're talking to me from the fourth floor. I'm up here, and it's like, I'm good. It's like there's seasons, right? There's a time to grow and there's a time to just bask in the sunlight, right?
Yeah.
You
Right.
know?
And to give yourself permission to do that.
Yeah.
That was
Yeah.
something that was so interesting to me as I planned this event and executed it, is
Yeah.
the beginning stages. The hardest part of this whole thing wasn't the planning. I knew in my mind exactly how I wanted to go, and I
Mhm.
executed, I don't say that word,
Spot on.
out of it.
Yeah.
I feel like it went without a hitch almost.
Amazingly well.
Like,
Yes.
I was so happy with how that, but the hard part is getting the buy-in, getting the women to trust me or the event or the process enough to lay it down. That's my big message,
Mhm.
is like, lay it down. Give yourself permission to come to this event. And then even when you come to this event, give yourself permission to really enjoy it. So many people were coming late because they, had to do clinic in the morning, or
Mhm.
someone was like, "Oh my gosh, this resort is amazing. I wish I would have come a day early because it's
Mhm.
so amazing. I would have loved to enjoy it more." And her friend was like, "Yeah, I would have too, but I couldn't justify taking off Thursday." And I'm like, "You could.
Yeah.
But you
You too.
could.
Yeah.
Who couldn't
Yeah.
justify? Why couldn't you justify? Who do you have to justify it to? Your patients, to your clinic, to your spouse, to yourself? This is investing in yourself and giving yourself enough time to actually be able to, okay, decompress, let your
Yeah.
cortisol come down a little bit, reset, and
Mhm.
find yourself, reground yourself. But it's so hard for us to do that. We have so many people that need a piece of us all day. Your clerk's coming to you with the schedule, and the patient's trying to get added on, and your kid's got all these activities, and the PTA wants you to join. There's so many things that it's really hard to give ourselves permission.
Yeah.
Aaron, I like the fact that you had to put your phone away. I think that really helped because you were truly able. It was really only like 48 hours that I was there, but
Yeah.
Saturday just seemed like a long, calm, nice day. And I felt really decompressed just because there was no phone, right? Put
Yeah.
it away. And even though we had activities, nothing felt like rushed. It
Mhm.
felt calm and happy and, come as you want. So
Yeah. That makes a big difference.
it does. It
Yeah.
does.
Yeah. Is there anything that you wish that you would have done more of?
I think maybe coming a day early and taking
Yeah.
advantage of some of the classes. I've been to Miraval before a couple of years
Okay.
ago, and I did find the classes to be really. I went to one that was like very eye opening. I had recently lost my mom, and then I went about 18 months later, and I went to a grief class, and
Oh, wow.
it really helped me put some things into perspective. So it was only like a half an hour, 45-minute group session, but it really changed my perspective on things. So, yeah, I think, next time if we do it again there, I'm gonna come a little bit early and take
Yeah.
advantage.
Oh, for
Yeah.
sure. I was like in
Yeah.
there as early as possible. I'm gonna take
Yeah.
advantage of as many of these classes as I can. And even the
Yeah.
ones
Yeah.
that seem weird, where I'm like,
Mhm.
I don't
Those are usually
know,
the
why
best
is this
Mhm.
ones.
class? I was like, I kind of feel like I have to, like, if I can, I'm gonna do that. They kept having slacklining, for example. I didn't have
Yeah.
a chance to do that, but it was like the only one that was every single day. And I was like,
Mhm.
either this is a really cheap, easy one that they just are trying to put on,
Yeah.
or it's pretty cool. So I told my husband, like, you kind of have to do that one, I think, because I keep having it on
Yeah.
there.
So you didn't
But
get a
Yeah.
chance to do it though?
I didn't. But,
No.
there's just those things like pushing yourself. Like, I never would think I could
Mhm.
walk on a slack line.
Mhm.
That's what it is,
Mhm.
like not
Yeah.
a tight
Mhm.
wire, but a slack wire.
Yeah. Yeah.
But those kind of things are really transformative. Or I remember last year they had a foam rolling class, and I'm like, "Sounds so boring,
Mm.
but I'm going to go to it because my trainers always talk about foam rolling, and I don't even know what that means."
Right.
And
Mhm.
it was so amazing. Like, whoa, foam
Yeah.
rolling class, man. Sounded boring, but it was really good. So, I mean, definitely choosing the resort was very purposeful,
Mhm.
move on our end to try to just really maximize that experience
Mhm.
of really just kind of diving back into yourself. So, I'm
Yeah.
glad you
Yeah.
enjoyed.
Yes, I did. I did.
So, tell us about the ropes course. So we did a ropes course experience. I was really happy that most of the attendees showed up this year, even the people that were afraid of heights,
Mhm.
I
or
was really
pretty
glad for that too.
nervous. What was your thought? Was that like easy breezy for you, or was that
So
definitely getting out of your comfort zone?
I like adventure, and so maybe about 10 years ago, I would have been, this is a breeze. But I have since torn my ACL. I've broken my foot twice. My hip was recently torn. I have a labral tear.
Oh my
So
gosh.
I was like, can I do this without injuring myself further? So I did it because I wanted to do it, but I didn't overexert myself. So I think restraint is what I learned
Yes.
on that. Yes.
Some
So
boundaries. That's
yes,
good.
some
Yeah.
boundaries. Yes. So.
How did you tear your ACL and you have a labral tear?
Oh, I, was trying to teach my son to be more aggressive. He was like 9 or 10 at the time to but in soccer. I kicked the ball and he didn't move, the ball didn't move, but my ACL in my foot took the brunt of it. I was like, "Go get your dad." And I was laying on the lawn in the backyard, and my son's just looking at me
No.
horrified. He said, "He didn't do anything." I was like, "I know, buddy. I know."
Oh
And
no.
yeah, I told him I broke my foot and then I was in a boot. And so the ACL tear was missed for a little while. And
Mm.
then, yeah, I was exercising and then
We've never
that.
been
And
so
I have
glad
no
to
idea
be
what I did with my hip. I just woke up
wear
with
and
hip pain.
tear. I
Yes, wear and
Seriously?
say
tear.
never so glad to be married to an orthopedic surgeon until that moment.
You know what though,
Oh.
Aaron? He missed my ACL tear, so I'm never gonna let him live that down. And I tell everyone, he missed my tear.
Well, I know Sarah's all for a ropes course. She's like adrenaline junkie.
I used to be, but I'm not anymore. It's so funny. I used to seek those things out, but now if it's lands in my lap, I'm like, yeah. But I love that stuff. Love it.
Yeah,
I'm
yeah.
like, what can I do that's harder? What can I do that's harder? I want to go up to the third level.
Mhm,
They're like, we don't have time. And I'm like, oh,
I know. I was trying to egg him on too.
yeah.
Well, I did before everyone came the day before we did a ropes course, my husband and I, and we did the lower level. And I was so nervous on that for some
mhm,
reason. And then the next day when we did it as a group, I went to the second level and it didn't
mhm,
phase me at all. It was
mhm,
just interesting to me. Like I'm up 15 more feet in the air and I think it was a little more challenging, but I don't
mhm.
know. I just
You
leaned
were
into
ready.
the confidence and the trust. They always had a cable up above, like in the middle that you could kind of
Yeah.
cheat or like hang on to. And so I was trying to
Yeah.
not do it or try to
Mhm,
balance. And I was always a little too afraid to let myself actually fall. But
mhm.
I think that it's interesting the things you can kind of learn about yourself when you put yourself in a spot you don't normally get the chance to
Yeah,
be in.
Here's a question
yeah.
for you, Erin. Do you think that, because I'm assuming that when you did it the day before, when you and Abe did it, there was other people there with you? I wonder if, because I think I find myself not wanting to make someone else's experience worse. And so all I am doing is thinking about like, oh, is there somebody behind me? Oh, is there somebody in front of me? Oh, and not just enjoying my walk across this tightrope. But I wonder if it was because you were surrounded by all of us the second day that kind of calmed you.
Yeah, maybe.
I
I
wonder.
remember that one experience in Miraval, my husband and I did one of these ropes course experiences and we kind of joke about it. We both are like, that was the scariest thing I've ever done in my entire life. They had, I think it was a 30-foot telephone pole. And at the top, it had this platform that was only like 12 or 18 inches wide. It was not very big at all. And you would do it with a partner. So you have to scale it first, and that part's not too bad. But then you have to somehow pull yourself onto this little platform, and there's no
Mhm.
wire or anything. Like
Okay.
there's nothing to grab onto or any kind of safety thing. So you have to somehow, balance and pull yourself up there. And then you have to stand there and then wait for your partner to come. And so your partner will have to climb up, and then you both have to be on this tiny little platform And mind you, my husband's like 6'3", 6'4". He's a big guy and he's up there and he's afraid of heights. So he went first and his knees were shaking and the whole thing was just swaying back and forth. And he was trying to get himself under control and he was up there for like 15 minutes. So this poor guy who's afraid of heights is just up there swaying back and forth.
No.
His knees are just
Buckling.
bouncing all over.
Oh,
And
no.
I was like, should I come? And he's like, I'm really worried. I can't get myself under control. So I finally like, I'm just going to come. I don't think it's going to get any better. So as I came up, when he started focusing on me, suddenly he stopped swaying. He got out of his head and he was focused on helping me. And so then when I was able to get up there, he was still a little skittish and, still a little bouncy, but not nearly so much. And I thought that was really powerful. Like when we are focused on ourselves, then you're just all in the thoughts and the scary feels. But when you have someone else to focus on, I think it makes a big difference. And then once you're up there, then you have to just jump off. And so he'd been up there so long, he's like, ready, let's go. And I was like, no, no. And I was like, also, but you're kind of bouncing me off. I think I'm going to fall. So he finally jumped, but then I had to stand there and like gather up my courage to just jump off this 30-foot pole with like nothing, I mean, obviously you're harnessed in, but yeah, I think sometimes just the environment and who's around you and that support system. And it was definitely
For sure.
people cheering each other on and, watching how other people did it and learning from their mistakes. I think that's really powerful. It's fun.
Yeah. I think that's
Yeah.
super cool. I love that story. I do. I was thinking about this, Sumi. So as oral surgeons, we often sedate our patients in office for procedures. Aaron and I talk about this a ton because we get so
Yes.
upset by all of the online haters of oral surgeons, like, I would never, and Aaron has done a very good job of stepping in sometimes and presenting a little evidence and saying, here's an article. And
Is it good
I
or is
just
it
sort
just
of
stupid?
avoid it because I think it just raises, I'm just like, it doesn't matter what you say, but the hard part for me is that I know that these are pediatricians and these are people that are forward facing in our community and they are sharing their fears with their patients, and it's creating more and more and more distrust of the training that we have all undertaken and the significant amount of data that we have that what we're doing is safe and that we are well prepared.
Right.
So that's something that we talk about a ton. And so recently you published a book based on emergency
I did.
responses and a crash cart. I'd love to hear more about it. I ordered it. It hasn't gotten here yet.
Oh, thank you.
Yes,
Thank you.
but I've got it. I ordered it and I'm excited.
Yes, like we all do. We do quarterly drills, monthly drills with our team. We want to make sure we and our team are all prepared in case of an emergency. Unfortunately, it might happen. With the way our staff is trained, even if they're anesthesia certified, it is still the heat of the moment, and you want to make sure you're doing right by your patient and everybody knows where everything is and we have our bearings together. And I'm really proud of my team. My team does, and we, I think, do well if the situation was to arise, and luckily it's not that often or has not been. But when we had a new surgeon that came into the office, we had an emergency, and it can be a little startling if you're working with someone new. So I put together this manual for my office, and my assistant, that she and I have worked together for over, I think, like 15 years almost at this point. And she's like, you should publish this. So I sat down and tried to put it into a formal manual. And then my dad is a retired ER doctor. So he sat down and went through every single slide with me.
Wow.
I have lots of friends who are encouraging ER doctors, ICU doctors, anesthesiologists that also reviewed it. And it is a book. I have 2 versions. I'm on version 2 now because I've self-published. I don't know how to self-publish. I've never done anything like this outside the box. So I just went to Amazon and then we have a version 2. So
Okay,
that
read
is
us
so
the
cool.
title for all the people just listening.
Yes.
yes.
Can you
Crash
read us the
Cart
title?
Quick Guide. A practical, easy-to-use reference for managing medical and anesthesia emergencies in the outpatient setting, and it has pediatric and adult dosing.
I
Crash
love
Cart
that.
Quick Guide. So my purpose was that if there's a situation that arises and or someone is not able to like think through or are doing something else and we're still able to focus on the patient, get the patient into a safe and healthy position, we can just flip to the emergency within this manual and you literally go down this algorithm and it'll tell you what to do. And we all know this, but having
Mhm.
it written down and
Mhm.
being easily able to be followed by anybody that looks at it, I think is a key to success. Oral surgeons and our anesthesia safety is well documented, as Aaron can point to the references, but it is still, yeah, I still have just this past weekend, I had an ER doctor saying, "Wait, you do your own sedations? Wait, what medications do you give?" And I'm like you, Sarah, I'm just like, "Yeah, I do." And I was trained. And yes, it is safe and I am safe in the way that I approach sedations
Yeah.
in the office. And it's a great alternative to patients when local anesthesia alone is not enough or laughing gas is not enough. And sometimes patients need sedation and it's just not possible to take them to the OR.
Right.
So, yeah. Yeah.
That's cool. And so how did you do the I'd like to know your process on self-publishing and then the Amazon.
So, yeah, I don't know what I was doing with self-publishing. I had no idea. I literally put it together. I have, like, a little bit of free time, and I put it together, and then I let it marinate for a while, and then I went back to it, and then I tried to republish it, and I reached out to a colleague in who wrote a book on dental sleep and sleep disorders. So I asked her, "Can you help me? Like, who's your publisher?" So she pointed me in some directions, and I was like, "I think I can try to just print this myself." So I got a copywriter and I got a local printer. And so that's how my first version went. I did sell about 40, 50 copies,
Oh,
but
Wow.
cool.
I am not a social media person. I don't post anything.
I'm
We
so
can
bad
change
at it
that.
too.
We
Don't
can change that.
market. Yeah. Yeah. So I was like, you know what? I have this pile at home and I don't know what else to do with it. So I started giving it out. That helped, I think, because then it got the word out and
Mhm.
then people are buying it. But I was like, I need more streamlined. So I reached out to Kindle Publishing, Amazon, and they helped me kind of rework the cover and they have my document and they print it on demand essentially and mail it
Oh,
out.
how
So,
cool. Okay.
yeah. Yeah. So it's been definitely outside my wheelhouse,
Yeah.
something very far outside my wheelhouse, and then I was like, "Is this even worth, like, me doing, or should I not publish it?" But I do think it's beneficial. I know I'm biased, but I do think that this is something that we could all use in our offices, and I have a couple friends that are pediatric dentists who sedate in the office, and they have also bought it, and the dosing is appropriate for their patients as well, so, yeah.
That's really cool. And I think just having because we
Yeah.
all have a document, we all have a little manual,
Yeah.
something that we have, but it may be
Yeah.
not so intuitive, or it may be a couple of
Right.
papers in a
Yeah.
binder and
Right.
so we can train our staff, but I love the idea of having something that is like I bought it because I'm getting ready to start doing a little kind of mini practice inside of a practice. And
Mhm.
there's no anesthesia there currently,
Yeah.
right? And so
Yeah.
I need to have a quick reference guide because I'm going to have staff that maybe is not knowledgeable in that realm and just something that's quick that I can reference, that I can teach with, and that we can use if
Right.
there is an emergency.
I I also think we are in a little island it's not ACLS, it's not BLS, we are in between, and sometimes we need references to things that are not on either spectrum. So
Right.
this is to
Mm.
fill that void in between for really just oral surgeons or
Yeah.
office-based anesthesia.
Yeah.
Well,
And it's
no
Um,
one wants to rely on their memory alone if there's an emergency.
yeah,
And
yeah,
especially, I don't know, am I going to be a deer in the headlights and it all just
yeah,
goes out? Or
right,
my staff, I don't want my staff to not know what to do. Or
yeah.
just for training purposes, it's so nice to be able to see and read it and
Right.
all of that. I
So we have
love what you're
ACLS
doing.
cards, right? Like ACLS gives us these algorithm
Sure.
cards. So it is essentially like that for like bradycardia, tachycardia. And I even put in rhythm strips because sometimes you're looking at a rhythm and you're flustered or your
mhm.
Yeah,
staff might be looking at it and we all can get flustered. So this just kind of takes the guess out of some of it.
I love that.
Yeah.
So, how did you have the confidence to do this? Because you talked about doing this thing that you've never done before.
Yeah.
And it's so easy to feel like you have to, especially the surgeon brain. If I assume you guys are like me, you have to have all the boxes checked off. You have to have done all of the research. You have to feel like you are the most well-versed expert possibly in the entire world of crash carts before you
Yes.
could release something like this.
I am
So
not the most well-versed expert. I wouldn't even put myself up there, but I double checked. I went through different literature. I had other professionals in the medical professionals look at it because I wanted to make sure that what I was putting out there was accurate. And I felt like I knew most of this already, so I just had to go through the motions of putting it together. We all do. We all know it,
Mhm.
but we have to put it together in an organized format. And I think when I told you I let it marinate, I did, because I went back like 2 months later to look at it and say, "Is this really worth doing, and is this in a proper format?" So there was some adjustments, but luckily everyone I showed it to was like, "Yeah, I think that this is good." And I actually sent it to some program directors, my program director and associate program director, and I think my associate program director's comments about it was really encouraging. He's a really nice guy, and
Yeah.
the fact that he had such nice things to say about it made me proud, where I was like, "You know what? I really do wanna go on Kindle and see if I can get this out to more people." So, yeah.
Isn't it funny that one we talk about this all the time, right? That one voice of encouragement that you weren't necessarily expecting. Because when you
Mhm.
said you brought it to your program director and assistant program director, I'm like,
Yeah.
my first thought was, "Harding, you did what?" Like,
Yeah.
and so the fact that that one came through as encouragement, you're like, "Whoa, I could do this," you
Yeah.
know?
Yeah, he's my gold standard. I try to live up to. He is just a great guy, and he sent me an email back, and he's like, "This is really great." So I was like,
Amazing.
"Okay, let me try to get this out there because I do think it's helpful for our practices." So,
Yeah.
and it's good for, like, even just training. I mean, hopefully
Mhm.
you don't need it. Hopefully it's just training purposes, but
Right.
God forbid you do need it, it's there.
yeah.
So,
Yeah.
how did I have the confidence, Erin? I don't know. Sometimes I'm just I have blinders on. Like, I wanna do something, and I tune out the noise, and I just do what I want to do, which is probably a bad thing sometimes. But sometimes we can't get where we wanna be if you're listening to all the people who are saying no to you, right?
Mhm.
Oh, for sure.
So, if in your mind you think that you can do it, I have been fortunate to have people by my side that have always supported me, and the people who don't support me, I don't listen to.
They're on
So,
the other side of the
yeah.
blinders.
Yes, they are.
Yeah.
Yes, they are. So,
Well, it's
Yeah,
the year
that's
of the
incredible.
horse, so the fire horse, no less. So put on your horse blinders and let's go,
Roll, that's right.
so,
right?
I was coming on this podcast with you and I was telling my husband, I was like, "Oh my gosh, I don't even know what I'm doing." I was like, "I am nervous about this." My husband's like, "You'll be fine. Just do it. You're fine."
You're fine. You're great. You're wonderful. We
Yeah,
wouldn't
I
have
get
asked
it.
you if we didn't think you would be.
Right.
Oh, thank you.
Yeah.
I'm honored. I really am. Thank you so
Yeah.
much.
So, I was thinking about something that you said. So, at dinner on Friday, you were
Yeah.
talking, and then it kinda got muddled up in conversation, and so
Mhm.
but you mentioned something about how being there, your husband was like, "You should go," or something like that.
Mhm. Mhm.
And I've really been sitting with that a lot. I was,
Mhm.
walking around the Grove the other day, and I was really thinking about
Mhm.
that because I think that at face value, when you say that, it sounds like you're asking your husband for permission to
Mhm.
go. But I think really what is so important about this community and about doing things like this is
Mhm.
that it's not asking your husband permission to go, but it is evident that there is buy-in from our spouses for how these things make us better women, moms,
Mhm.
wives,
Mhm.
surgeons, dentists,
Yeah.
community members, all of the things.
Right.
Because it's not that I need his permission to go, because I don't, right? It's
Right.
that
Correct.
he's like, "You should go," because he
Right.
knows that it's gonna make me a better person.
Yeah.
It will give me
And
the confidence to say yes when I
right.
normally wouldn't, things like that.
Right, and I don't ever really ask for permission. I don't really get held back from anything, but it is a partnership when you're in a marriage, and if I'm leaving, that means somebody else has to pick up what I
Mhm,
would be doing. So even he says, "Can I go to this on this day? What are we doing?" Because it is mutual respect for one another. It's
Mhm.
mutual respect for one another and to make sure that our children are taken care of because they are still the priority, right? So
mhm,
I can't just up and leave and not have things covered. And he
yes,
can't up and leave without making sure that things are covered either. So
mhm,
it's not asking permission. It's just, I guess, like a mutual respect so
Mhm.
that we talk about it. Right.
Mhm.
So
Yeah,
I'm not going to be like, I'm leaving for this weekend. You figure it out. I would never say that because I don't think that's fair to him or my kids. I don't think it's fair if he was to speak to me like that. So
right.
luckily, that is not how our relationship is. So maybe it did come across like I was asking for permission, but it's not. And I do think exactly what you said, this time away and time in certain atmospheres with other women dentists and
Mhm.
oral surgeons is reaffirming to us as women. And I think my parents' generation didn't necessarily have this, and it can be hard. I think we do feel more supported when we have other people that we can turn to that are in similar situations, and then get positive reinforcement from them, as opposed to the naysayers.
Yeah,
Yes.
Yeah,
definitely.
yeah.
Yeah.
Well, I am so happy that you trusted the process and asked for the permission, or no, that your spouse was, able to kind of pick up the slack and let you come. And hopefully it was a rejuvenating experience. I,
Yep.
as the founder, was just so happy and grateful because I know it's so hard for people to step away. There's so many things pulling
Mhm.
at your time, and it's hard to trust new event and a new person that you don't know, and to pay the money and to more probably pay the time and the logistics and stuff. And I was just so glad that we advertised, pre-sale. I don't even know
Yeah.
where we're going or when, but if you want to sign up today, great. And I was trying to do the math. I think I had like 21 paying attendees at the event, and I think like 18 or 19 people have already, committed to
Mhm.
coming back next
I
year.
signed
And
up.
so,
I signed up.
yay!
I was 2 days late because I was, like, traveling and didn't pay attention, but yes, I did sign up.
Well, I'm
Yep.
so
How many did you
glad.
have last year, Erin? I think last year to this year was, what,
I
more,
think we had
right,
like
Yeah.
than the first year?
18, and then this
Mhm.
year there was like 24, but a couple people had to miss because of family emergencies.
Yeah.
But so we're definitely growing. But the fact, I'm
Yeah,
like, wow, we
definitely
got like
growing.
almost 90% buy-in already.
Mhm.
It was just really reaffirming to me and hopefully to people that might be interested. Hardest part is just getting you to come, but the people that came seemed like they really loved it
Mhm.
and want to
Yes.
come back. And that's because
Yes.
it was very valuable experience. And that's what we're trying. I feel sometimes I'm like twisting people's arm or like begging them,
Mhm.
please just come. It's going to be amazing. But it
I
really was.
think
Yeah, it's like it's hard because then you feel like you're selling it, but you're like, "But it actually is."
yeah.
Yeah, I
Yeah.
hate the sales part. The marketing and the sales part is the worst, and my mentor and my coach, Jessica, she's always like, "You're not selling, you're serving," and that's really what it
Yeah.
was, and that's what it felt like for me as a founder. I was just so happy because I felt like it really felt like light and love, and that's what I was trying to bring. Like, it really
Mhm.
felt like light and love and service, and it was this thing that I wanted to bring to our community that I'm really passionate about sharing. And I'm just so glad that it seemed
You
like
did
it
it.
resonated and was shared
Mhm.
and was received, and all about just spreading more love and light and those opportunities. And I would say the same for you, Sumi. Your book is amazing. It's a real
Thank
service. It
you.
was definitely a
Thank
Mhm.
you.
gap. I've had similar issues where I'm like, man, it's so hard to train my staff. I'm just relying on the things I can remember and find.
Yeah.
Or, we found some computer thing that keeps getting erased. So
Yeah.
to have a
Yeah.
hard copy, or if the power goes out, there's so
Yeah.
many things that can happen. And so it's really not about selling books or selling retreats. It's about
No.
filling a need and
Yeah,
serving
getting the
and
information out
helping.
and yeah, exactly, exactly.
So
Yeah.
we will definitely put a plug for the book in the show
Thank
notes if
you.
anyone
I
needs
appreciate it.
the
I hope
info.
Yeah, we may only be like 11 to 14% of the entire oral surgery community, but we sure are making a difference, right?
yeah.
Yes.
11 to 14% is way more than it was even like
It sure
5, 10 years ago.
is.
So,
Yep.
yeah. Yeah. So, we
And
are
it's
making
because of
changes.
amazing people like you, and probably me
Yes.
being visible. Like, what was your
You
friend's name?
Fizza?
Or the lady
The
that inspired you, the dental student?
Oh, yeah, Cohen.
Lisa Cohen.
Lisa
Thank you,
Cohen.
Lisa Cohen.
Lisa.
Yep.
Thank you,
Yes.
Lisa.
Yes, Lisa Cohen. Yeah, she's in the DC area.
Oh,
So,
cool.
That's great.
she's
That's
yeah,
great.
she's really nice. Yeah.
Yeah,
Well, any last
we're doing it.
minute thoughts or anything anyone has to say before we close out?
Thank you guys for having me. I enjoyed
Yes. It was such a
chatting,
pleasure meeting
and
with you.
yes.
I think my biggest regret from the whole time is that I didn't get to spend more one-on-one time with each and every person. You know, I got nice touch points, I think, but I
Yeah.
really like, you
It
know,
goes so
it
fast,
goes
that's
so
why you gotta
fast.
go a
It
day
does.
early. Yeah,
Yeah.
for
It goes
sure.
fast, but I felt like I was able to meet everybody
Mhm.
and, it was a small group, so it was nice. And Erin, you are starting something great here. So
Oh, thank you.
you should be very proud of yourself too. And Sarah too, you did great. Your two-factor authentication. So, and this podcast.
Thank you.
Yes, thanks so much.
Thank, thank
Alright.
you.
Well, thanks for joining us for another episode of the Resting Stitch Face podcast. As always, please like, share, and leave an amazing 5-star review, and we'll catch you next week.
See ya.